Prof, I don't know if you want to touch on what ankylosing spondylitis is, give people a little bit more of it's big words that not everyone will have an idea of.
Thank you, Shelly. So ankylosing spondylitis is one of the diseases that we will call inflammatory back pain. You will recall that earlier I said mechanical back pain, and the opposite of that will then be inflammatory back pain. So the patient will tell you that they've had chronic back pain. It has a gradual onset. It's usually people younger than 45 years old, and they will complain of pain and stiffness more in the morning, while with mechanical back pain, it's usually during the day when they do certain movements. And typically people with what we call ang-spon will feel better if they move. So you want those people to do exercises, and they will tell you that, you know, in the night they have pain because they're actually lying still. Ang-spon is just one of the possible diseases that you can get with inflammatory back pain, and that now goes back to the bit I've said on the first case, where you now need to know if there's skin involvement or other organ involvement for possible things like psoriatic arthritis, reactive arthritis. All of that can come into play. But I think what's important in this patient is that he may have double pathology. So he has been diagnosed with ang-spon, implying that he's possibly HLA-B27 positive. It's a gene that they carry in 90% of these cases. But he also tells you that he has been sitting for a long time. His work is IT, so most probably he's sitting behind his computer. We've all been in lockdown, you know, doing a bit of exercises, and then we sort of revert to working on the computer. Some have time to watch television or do some gaming.
Prof, I'm sorry, I'm interrupting you, and I know that's rude, but can I just say I'm quite chuffed that even though we're in lockdown, that's the first time we've spoken about lockdown tonight. You know, it's been so refreshing to actually have a conversation that hasn't been revolved around lockdown. So apologies for interrupting you, but
sorry that I now brought it up.
No, I think it's great. I think it's excellent, but it's been quite nice to not have to have that. So I apologize for interrupting you. But
no, sure. So, you know, in this person's case, we will need to perhaps think that there is another problem as well. It's not necessarily the ang-spon playing up. There can be a mechanical problem, so he will need a proper assessment like Darryn alluded to in the first case.
Prof, can I just quickly throw a question at you, just for clarity? Ang-spon is a lifelong problem?
Yes, absolutely. So the HLA-B27 gene we find in a few people, and I think also a misconception is that when people know that they have the gene, they think they have the disease. That's also not true. So the gene can go what we call dormant. It's only if the gene is active that you will actually have disease. You will have pain and you will have stiffness. So you will carry the gene for the rest of your life, but you may not have active disease always. And typically what we see in patients with ang-spon, they have a clinical picture that sort of, you know, it comes and goes. And that's also many times why patients will stop medication, because they start to feel better, then they stop their medicine. It's not like with the other diseases, rheumatoid and that, where you get, you know, the disease just progresses over time. Ang-spon comes and goes, and so the patients many times, unfortunately, play around with medication. But I think the important message is that you carry the gene for your life, but you don't need to have the disease for the whole life.